Hello everyone, it's Dr. Atkinson. Today, we'll be discussing fractures of the nose, one of the most common facial and overall fractures in the body. Because of its location, the nose is especially vulnerable to trauma. Nasal fractures usually result from a direct blow or assault. The injury may involve not only the nasal bones, but also the ascending process of the maxilla and the nasal septum. When the mucous membrane tears, epistaxis, or nosebleed, is common. Potential complications include hematoma, infection, abscess, or necrosis. The good news is that serious long-term consequences are relatively uncommon if the fracture is recognized and managed properly. Clinical manifestations. The typical signs and symptoms of a nasal fracture include pain, bleeding externally or posteriorly into the pharynx, swelling of surrounding soft tissues, periorbital ecchymosis, or black eyes, nasal obstruction, and deformity. Sometimes the deformity isn't immediately obvious because swelling hides it until the edema subsides. Assessment and diagnostic findings. Every nasal fracture needs a careful exam. Intranasal examination is performed to check for a septal fracture or a septal hematoma. Hematomas must be ruled out because they can lead to permanent deformity if untreated. Because of swelling and bleeding, an accurate diagnosis is often delayed until the edema decreases. If clear fluid drains from either nostril, think cribriform plate fracture with cerebrospinal fluid leak, a serious complication. Inspection and palpation may reveal bone deviation or cartilage disruption. X-rays may show displacement and help assess for extension into the skull. Medical management. The priorities are airway, breathing, and circulation. And never forget to rule out a cervical spine injury in any facial trauma patient. Management includes packing to control bleeding, cold compresses to minimize swelling, antibiotics, analgesics, and nasal decongestants for uncomplicated fractures. Referral to a specialist for fracture reduction. Timing is critical. Ideally, reduction is performed within the first 3 hours of injury, before swelling sets in. If that's not possible, it's typically done within 3 to 7 days. Delays beyond that increase the risk of abnormal bone healing and may require surgical intervention, such as rhinoplasty or septorrhinoplasty, to restore both function and appearance. If a septal hematoma develops, it must be drained promptly through a small incision. Untreated hematomas can cause cartilage destruction and permanent nasal deformity. Nursing management. Nurses play a major role in immediate and follow-up care. Apply ice packs and encourage the patient to keep the head elevated. Provide reassurance. Patients often feel frightened or anxious with bleeding and swelling. Packing can be uncomfortable, and mouth breathing can cause dry mucous membranes. Offer mouth rinses to help with dryness, odor, and the taste of dried blood. Pain management with acetaminophen or NSAIDs, such as ibuprofen or naproxen, is encouraged. When packing or pledgets are removed, carefully inspect the mucosa for lacerations or septal hematomas. Finally, patients should be instructed to avoid sports and trauma risk activities for at least 6 weeks to allow proper healing. That's our overview of nasal fractures. The keys are recognition, airway safety, timely reduction, and careful nursing support.